Alright, today we're doing our educational video on SmartLipo. We'll take you through the entire patient experience with SmartLipo. I use the SmartLipo triplex machine. It's the state of the art in lipo. It's a $180,000 liposuction machine. It does deliver the best results. The three things I like, well, two main things I like about it are that we use the laser to melt the fat, which gives you superior results. It gives you better fat removal, and it gives you smoother results because you've melted that fat. The other thing that I like about it is the laser shrinks the skin. So those are kind of the two main things: skin tightening, fat liquefaction. So we'll take you through the whole process. Right now we're going to mark the patient. So we have a nice volunteer patient here. She'll come on over and we're going to mark her back. We're working on the back. Now, back, upper back right here, she's a very trim patient, just has this little isolated area. And SmartLipo's strengths are, so if you come in, this is how we'll mark you, but its strength is that skin tightening component. This area is one of the lowest patient satisfaction areas in liposuction because the skin doesn't shrink that well with traditional lipo. With SmartLipo, it will tighten more. So we will numb this area. I'll make a little poke about right here. A lot of people ask what size incision is. That's all there is. I put it right in where the swimsuit line will be. Then I mark a few little quadrants here. The laser has a really cool temperature probe on it that will measure the temperature as I melt the fat in each of these squares. So I'll heat these squares, and I'll show you this, to about 45 degrees, and then this little beeper will go off on the machine. You've heated it to 45 degrees. Then we know we've melted the fat, and we move on to the next square. So that's why I draw these squares on here. So we're going to lipo this area. We're also going to come down now in the hip area. I get real low here. The jeans today are pretty low, so I like to get very low. And then we focus on the hips. So we'll come in all through here again and liquefy this area. We'll draw a little grid so that I can stay. If you don't stay within these squares, you don't heat the fat effectively enough. So we're going to first come in, tighten the skin. Second phase, liquefy the fat. Third phase, remove the fat. So a lot of people come in and get confused, and they're like, are you going to remove the fat, or is this one of those machines that through the skin you melt the fat and leave it there? I think you get far superior results by removing the fat. So we melt the fat and remove it all at the same time. So that's what we'll do. So our next phase will be numbing the skin, and we'll come back and show you that in a few minutes. Okay, now we're moving on to the numbing portion. I like to do these in the office, as I said earlier, because the patients often, this is a procedure where you don't really need to be asleep under general anesthesia, and many patients don't want to be under anesthesia, so they love doing them in the office. Of course, the first question they ask is, how much is this going to hurt? Will I be able to do it in the office? So this portion will help you to see that, and we'll have Robin here tell you how she's feeling. So right now, this is where I'm going to liposuction from. That's the size of the incision, which many people ask. This is the numbing medicine. Believe it or not, this little poke right here is usually the worst part. So there's the poke, which you see a little, how's that feel, Robin?
That's all right.
It's all right. Just a little poke there for the numbing so that can work. Through each of these sides, and I place these very low. You can see that they're actually right inside the tan line there. Then we'll go up here to numb these. I'm going to move these out just a little bit more to the side, about right there. Again, this is the numbing. But it's very comfortable, and I think the benefit to the patient of not being under anesthesia is good. Plus, I can actually move you around a little bit and reposition things when we do them in the office like this. Also, it kind of forces us to wait longer to do the procedure. Now, this is just a little poke. And she's numb now, so she's not feeling that. Good. When you wait longer for your numbing to take effect, you get better fat removal, and we've seen that always in liposuction. So being in the office here, another benefit, forces the doctor to wait longer to do the procedure. Then the final benefit is there's obviously a little bit of cost savings, which people like as well, because it's a little less expensive to do it. Now we're going to introduce the numbing. This is a little blunt needle that I place in through our little incision and start to numb with. So we get it under the skin. Then Karen will start the pump over there and we'll numb this. This is tumescent solution. This is called tumescing. And you can see we're moving right along and numbing. No significant pain there. So we're going to numb this whole area. The purpose of tumescence is that it makes you numb. It also has some epinephrine in there, which makes you bleed very much less, and that's its purpose. So we're going to numb this whole area, and then we'll come back and show you the laser portion next. Now we're starting the lipo part. This is the size of the laser fiber that we use, so it's very thin. That's all the bigger we need the incision. Right here at the end is where the energy comes out, the little lead bulb. It also has a temperature gauge right there that measures how much we've heated the fat so that we know we've melted the fat effectively. Right now the temperature is 27 Celsius. You can see it right there on the machine. This is the laser. We'll heat it up to about 45 degrees, and that's the nice part. We know exactly what our temperature is. We can melt the fat aggressively for a smooth result, and we can tighten the skin aggressively for skin tightening without worrying about burning the skin or any problems, because the machine tells us exactly what the temperature is. So that safety factor actually enables you to be more aggressive as well. Now we're doing what's called superficial release. You can see the red light moving under the skin. That's the laser. It's heating that skin up. It's right under it. Superficial release is what gives you the skin tightening. Our laser is pumping energy in under the skin. As I move back and forth, I pick one small square here to focus on, and I just keep moving back and forth. Our temperature is already up to 36, so that's great. And we just want to sit in this area, tighten this skin. Our probe will go off telling we've heated adequately, and then we'll move to the next little square. So this component, superficial release, important for skin tightening. We'll come back and show you the fat melting part where I go deeper and melt the fat with the laser. How are you feeling, Robin? This is the process. Are you feeling anything?
Feels nice and warm.
Feels warm? Feeling good?
Oh yeah.
Okay. What would you rate your pain as? Do you have any pain?
0.
0. Okay, good. So, you know, a lot of people are real nervous and scared, but it's really not a difficult process here in the office. We have good, strong numbing in there, and it enables me just to do this whole process. We're adding out, obviously, large portions, but the actual liposuction part probably takes an hour. You know, it takes an hour to numb and get everything set up, and then an hour to do the process. So we'll show you the fat melting next. Now we're doing our fat melting. So we've done superficial release. Again, skin tightening and fat melting are what really differentiates SmartLipo from regular lipo. They both involve fat removal. So now I'm down deeper. You can't really see the probe. I'm down in the fat, and I'm melting that fat. So our temperature right now is already 45 degrees, that's Celsius. So we're liquefying the fat right now. You hear the beeping noise. If I stay here for a second, it'll heat it up to the point where it'll alarm out pretty soon, and that means we've maximized our heat. That's what we want. So we're melting fat, using laser energy to melt fat. Again, pretty painless, huh, Robin?
Oh yeah.
Good. And we're just cruising along. And the machine's telling us how much energy. We put almost a kilojoule of energy in, and I'll just keep melting this fat. And another nice thing about the melted fat is we'll show you in the canister at the end, the percentage of what we remove is actually 80 or 90% fat as opposed to a lot of liquid and other things. So we get very dense, good, even fat removal. So we're cruising along here, melting the fat. Karen's over there running the machine. You can zero in on the temperature probe if you want. There it's 46, and that's our total energy, 47, and it just keeps cruising along. I keep putting in the energy, the numbers go up. I'll keep going until it alarms, and you can edit it a little bit, but we'll get there. 47, what's it set for, 50, honey?
50.
So we only got a couple more degrees to go. Here it comes. So now we're at 49, and there it goes. It alarms, and then we restart again. So that's nice. The machine has that safety factor that you can push it to the outer limit, and it'll say, okay, you've pushed it as far as you can, stop and move on. That way the patient can be assured that we get nice removal. The triplex is the first machine to have that thermostat on the end of it, and that's what I like about it. Push it to the limit, maximal results with safety. Now we're starting the lipo part where we'll actually remove the fat. These are the two cannulas mainly that I use. I use this decent sized one to get the beginning early fat out, and then I changed, this is actually a face cannula, it's very fine, but I like using that to sculpt things out and make sure that we get a nice smooth result. So these are the two cannulas that we use to remove the fat. They fit nicely in the incisions here. We just slide that in under. And it's a little more physical, but still, how are you doing?
Oh, it feels nice.
She's good. She's doing fine. You can see the fat coming out the tube right here. That's the fat. And we'll just keep suctioning along here. Alright, so now we've finished up. I put a little stitch in each site. This is the size of the incisions. They're very small. They only require one stitch to close them. I like to close them, so we'll put a stitch in each one of these. We'll put a garment on that you then wear for 3 weeks to stop things from swelling. So the garment's 3 weeks. I see you a day afterwards. I take the garment off, and then you can take a shower after that. And then there's the fat that we've removed sitting in the canister. It's all liquefied, and that's the process.